Are you losing consults because you're giving away your power? And you're probably not even realizing that you're doing it. Now, I get it. Empowering others on your team, whether it's an assistant or your front desk to kind of bring it home for you or just tie up the loose ends. I get the desire and appeal of doing that, but you're giving away your power with your patients or your clients, and you are really sabotaging your chances of success. So today I'm going to be going over how to take back your power and getting your patient's commitment to start the treatment plan. Now, why this is such an important topic that I really wanted to cover today, because I see it happening time and time again with doctors, physician assistants, plastic surgeons, master trained estheticians, or laser technicians, right? Time and time again, you spend 30, upwards of an hour plus with a patient developing this amazing treatment plan, this amazing rapport with your patient. And you're really excited about the results that you can get them. You're excited about the connection that you made with your patient and the potential revenue that you could make for the med spa, for your compensation plan, all of these things, only to find out that the patient didn't end up scheduling their appointment after you handed them off, whether that's to the consultant or the front desk or your assistant. I see it time and time again. And the reason I know this to be true is because when I identify a sales challenge based on the numbers, based on data, right? Like I see you had this many consults and this many lost consults in your numbers, right? Also, I experienced for myself firsthand when I am a secret shopper. And that's that these providers, again, doctors, master estheticians, master laser technicians, physician's assistants, nurse practitioners, plastic surgeons, dermatologists, literally, you name the title that is used when they introduce themselves, because they know that it brings authority and power to the conversation and credibility to the conversation. And yet they are not closing the deal. They're giving away their power and they're handing it to someone else because they think their job is done. And my challenge to you, provider, is that you understand the importance of your power, right? Your expertise, your credential. Otherwise, you wouldn't be so quick when you introduce yourself to be like, hi, I'm Dr. Smith, or like, hi, I'm Sue. I'm a master trained cool sculpting technician, whatever title it is that you have earned rightfully, right? You understand the power in that, in developing that treatment plan. And so I ask you, why is it then when it comes to getting that commitment from the patient, why you are then handing it off? Now, a lot of you might say like, well, I'm busy. Well, I don't know the pricing. Well, I don't do the scheduling. First off, it probably costs you upwards of a couple $100 to $750 to acquire that consultation between marketing and overhead and whatnot. On the low side, a couple $100 plus you pay the hourly, right? So is it worth it to spend a few extra minutes to, one, learn your pricing, two, not leave the room until like literally the deal is signed. Now, that's the ideal situation that I would love to see. But if you can't do this, this is what I would at least like for you to consider, is to get the commitment to the treatment plan and that you do want to move forward, right? So that if you're handing it off to your front desk or your assistant or another patient coordinator, right, then when you go to hand that off, then it's like, hey, Sue, Caitlin is going to go ahead and get started with the package of 3 RF microneedling. She wants to get started right away. So my soonest availability, I want to make sure that she preps her skin for this treatment with this skincare product. And I'm going to want to see her back every 4 to 6 weeks is the scheduling interval time for the package of 3 RF microneedling treatments. She's also interested in our membership so that we can make sure that she gets that extra discount for the package that she's purchasing today. Sound good? Any final questions? Great, let's go. But what I'm seeing happen is doctors especially are guilty of this. Physician assistants, plastic surgeon, dermatologists, especially guilty of this because they're medically trained to tell the patient what they should do. The patient listens and they leave, right? They don't have to worry about money or scheduling with their background, right? But what we know to be true is that aesthetics is different, right? Like they have choices. They don't have to get this treatment plan. And so when a woman starts to get time to think about things, we lose them, right? Because then it's like, oh, well, Jackson I need to sign him up for a club team and it's expensive, right? And so we want to get that commitment right then and there. And it really helps if your provider is the one that gets that commitment, even if they're not scheduling or running the patient financing, collecting money, going over the finances, any of that. I get that, right? But you need to get the patient to say yes, right? Because if they say, oh, well, it depends on the pricing, right? Then I would come back and say, oh, okay, I totally understand that. Sue is going to go over pricing for you, but I just want to make sure before I step out that you believe that this treatment plan that we went over today can get you the results that you are looking for. And if money wasn't a consideration, then you'd be ready to get started, right? The reason why that's so important is because what you don't want to happen, right, is for them to leave. And really the objection is they don't really think that this treatment plan is going to get them the result that they're looking for. Or maybe, right, like you spent all this time talking about the like cool sculpting, but really she was most concerned about her double chin, like her cool sculpting on her tummy, but really she was most concerned about her double chin, right? So it helps you, right? If you want to get the commitment, then it makes it really easy for your assistant or scheduling person. But if they say, well, I'm unsure, right, then you can uncover what the true objection is, right? So if you're the provider and you lose because of money, right, then that's on the front desk explaining the patient financing and helping them work through that and pre-qualifying them right before they leave. If it's about scheduling, about the membership or discounts, all of that, right? But if it's about, I'm just not sure this can get the results that I'm looking for. I'm scared of the downtime or the pain, right? I'm unsure of how it's going to work or how it's going to feel. So, but because we're leaving without getting the commitment of, yes, I want to do this, you're not really getting the true objection. At the end of the day, the provider always thinks it's about money, right? But oftentimes it's not necessarily about that, but we never know that. We always just assume it because it's very easy to say, I got to check with my spouse, right? I got to check my finances. I got to check my schedule. So that's why I always come back to, okay, I understand that. Those are important things that you need to weigh out. But I just want to make sure before I leave, we're on the same page of this treatment. You said that X, Y, and Z was your main concerns. And we reviewed, and at the beginning of our consultation, you shared with me that if we were to develop a treatment plan that you believed could get the results that you were looking for, you would be interested in following it. So I just want to make sure before I check out here that we're on the same page, and this treatment, you believe that this treatment plan can in fact get you the results, right? All those other things Sue can cover and go over with you, but I just want to make sure that I didn't forget or not miss anything that you had questions about. And that is powerful, right? Because this is where you're going to get better in the consultation if you uncover these true objections, right? And if it is about price and scheduling, then we can practice and train on that part with our front desk, with our consultants, our patient care coordinators, right? We can, those things to me, those are easy ones to get over. And in fact, we've spent a lot of time in this last month going over those, right? How to utilize patient financing, AKA the patient promo, monthly payment promo, 0% monthly payments, right? Like we spent a lot of time talking about that. We spent a lot of time about the rebooking and getting micro commitments along the way. But when I'm doing secret shopper experiences, when I'm really breaking down consultations with teams, time and time again, I hear the objection of like, well, they weren't qualified. They were broke people, right? And I find that oftentimes we're not really uncovering the pain point or the true objection of why they didn't move forward, because there's between memberships and patient financing, there are so many options for women to get these great combination comprehensive treatment plans that it's rare that budget should be an issue, right? If you could break it down into a monthly payment that's a couple $100s a month, women are going to move forward with it, right? So we want to make sure that the provider is getting that commitment and really setting up their team for success, because you just spent an hour with them, 30 minutes, an hour with them, and you have this great connection, you have this great trust, and then you're handing it off. And if it's so easy for me to say, like, once the provider, once the person that invested all this time and energy and love and connection into me leaves the room, it's really easy for me to say no to someone else, no to a stranger, right? And so you want to get that commitment and then say it out loud again to the person that you're handing off, because then it's really hard to go back on what you said, right? And this is such a little thing, but I promise you, you will increase your closing rate in your consultations, in your comprehensive treatment plans, when you take back your power, get the commitment from the patient at the end of the day. All right, so any questions on what that looks like, what that sounds like? And really, like, you don't have to change your consultation process that much. If you're not getting the micro commitment at the very top, right? The example at the very top of that consultation after you uncover their pain points is, if I were to develop a treatment plan that could get the results that you're looking for, would you be interested in following it? Yes, I would. Or maybe they tell you right then again, well, it depends on price, right? So now what you're up against, right? And then you can make sure that you're mirroring their language and concerns when you're presenting in their treatment plan, okay? And then at the very end, right? Like, are you ready to get started? My first availability is on Friday, or I'd love to get started with you on this treatment plan next week, right? And get a yes, right? Well, yes, but it depends on the price. And they're like, I don't know, right? Okay, well, I just want to make sure that before I leave and hand you off to Sue to go over our membership, go over our patient financing, our patient promo for monthly payments, before I hand you off to Sue, I just want to see that I've covered everything, right? So if price and budget wasn't an issue, do you believe that this treatment plan could get you the results that you're looking for, right? And you're really going to uncover the true objection. some of the things that you can't overcome, right? Like if it is about a price and they don't qualify for patient financing, right? Then you can come back and be like, okay, well, the package of 3 really is going to be what it takes to get you the results that you're looking for. But I want to get started right today so that we can get you one step closer to ultimately that end result that we're looking for. Now, I'd love to see you get started with the first treatment, right? But know that we are going to do number 2 and number 3 when your budget allows, right? Because otherwise you're not going to give that full result. But let's go ahead and get started. And then when your budget allows, we can do the second and the third treatment. Sound good? So you'll be able to pare it back, right? Or like, oh, I can't do the big daddy old therapy or opus. Okay, well, maybe you have to go down, like I'll never be able to do that. Well, maybe you have to go down, traditional microneedling and some medical grade skincare. But if you don't ask the tough questions and getting a commitment, you won't know where to shift. And too often we just rely on the follow-up call after they leave to get the commitment, and you're pretty much dead in the water. Like the close rate after they leave is much, much, much lower, no matter what they say. All right. Okay. Thank you so much for joining me. If you love this training, make sure you share with your team or another med spa that could benefit. And to get access to more free trainings that will help grow your med spa, visit my link tree in my social bio, and be sure to join me live every Wednesday, 2:30 Central Time, same place. Find me on Instagram, YouTube, and LinkedIn. Thanks, guys.